Okay, thank you for the handful of you who came back. Could we have the next slide, please?
This is crazy.
Yes, okay, no disclosures. Go ahead, and after that. So this is a bizarre case of a 50-year-old woman who was referred to me by a dermatologist.
I can't believe it.
She had had blepharoplasty 15 years ago, and she had blepharopigmentation with eyeliner of her upper and lower lids about 3 years previously. And the only thing that I could pull out of her history that sounded like anything at all was that she had recent bed bug bites. She stayed in a hotel someplace and got bed bug bites.
Oh, jeez.
So, I mean, it sounds crazy, but I just absolutely could not come up with anything else. So go ahead and show the next slide, please. So when she came in, basically, and those photos aren't great. The left photo, her eyes are open. She's looking up, showing the infraorbital incision from 15 years ago, which had been completely fine, developed hypertrophic scarring. When she closed her eyes, the blepharopigmentation, so the lower lid, she had blepharopigmentation and blepharoplasty scar about in the same place. So it was one big thick scar. In the upper lid, there was hypertrophic scarring where she had had blepharopigmentation and hypertrophic scarring where she had a blepharoplasty scar. That crusty thing that you see on there, she'd gotten an intralesional steroid injection from the dermatologist who referred her a short time previously, and she said she got a bit of crusting from that. So that's what you're seeing. She'd received that injection probably a week ago. That's all she had was the one intralesional injection, and she got crusty, so they referred her to me. So the question is, I have no idea what's causing it. If anyone has any ideas, can tell me why someone 3 to 15 years later gets reaction of scars. I'd be love to hear that.
I think you said something quite interesting, that she had recent bed bugs. And what if there was a bite there and created, because the hypertrophy is recent, like all of a sudden, so clearly there was some inflammatory
The bites were on her trunk.
Right, but what if the inflammation landed in the scar area? I'm convinced we don't actually.
Hyperstimulated immune.
Yeah.
I definitely think this is a hyperstimulated immune system for sure.
For sure.
And I mean, bed bugs would make this happen too. I mean, I think that's what this has to do with. And I think you can't underestimate what Yael just said, that this could have been a bite on the eye area that caused this. You know what I'm saying?
Yeah.
Yeah,
or flared it.
Because she obviously had bilateral blepharoplasty, and the other side was fine.
Then it was a bite.
As far as she knows, the bites were on her trunk, but can't say.
The crust was for what, you think?
Was from an injection.
Ah, okay.
Yeah,
so
she had an injection. That was not.
Got it. That's not like she presented. Like,
And the bites were several weeks earlier, so the timeline is maybe appropriate for that. Yes.
Are there any other scars on her body that also disease?
No.
How about COVID?
I mean, yes, but no. Yes, other scars. Nothing else became inflamed.
What about COVID vaccine or COVID exposure?
Oh, this is before COVID. This is pre-COVID.
Don't you know we blame everything on COVID?
I know,
now,
right?
on the vaccine.
I know.
I was going to be genius on that one.
Good question. But to that point, no antecedent URIs, no antecedent vaccines, all no new products, all the things. Well, she had her eyeliner was tattooed, yeah. So, and there's hypertrophic scarring where her eyeliner tattoo was placed, as well as so there were 2 scars in the upper lid, one at the margin, one in the eyelid incision, and just one in the lower.
I would
can
guess. I'm sorry.
No, I was just going to ask, the left picture, the picture to the left, the first one, is that pre any treatment?
That is after steroid injection by her dermatologist.
Okay. So that's why it looks a bit ulcerated.
Correct.
And then I would guess that she was using fake eyelashes, per what you're saying in the audience with the silver headband, because look at how ripped out her eyelashes are. Unless she has trichotillomania, but what common things are common, she probably is using lash extensions, and so the glue might have aggravated the situation, but I think it was immune stimulatory to begin with.
Stimulatory, it was 100% immune stimulatory something. So then, wow, what did you do?
Okay, so next slide, please.
100%.
Yeah, so like what the heck do you do? There
What do you
really
do?
is not a whole lot of options. I mean, you can basically inject it or laser it. I didn't feel like topicals were going to make that much of a difference for her. And I ultimately did laser-assisted drug delivery a little bit. So go ahead and show the next slide, please. And here's what I ended up doing. I used CO2. At the time, that was the energy that was on a luminous device, but fractional ablative CO2. I did a total of 5 treatments once a month. Next slide, please. And that's where she ended up settling down just fine. But a bizarre
Oh, wow, beautiful.
case.
Wow.
You really helped her, you know.
So it's better lucky than good.
I say luck equals years of experience, in my
But it
opinion.
was just a very unusual
Any-
presentation of late eyelid
comments?
scarring.
Comments, questions, quickly? We have one more case that was my case. Do people want me to present it, or do we want to leave? It's just a case. Should I present it?
Present.
Yeah, present, might as well.
We'll do quick.
Run over.
Any questions about this oculoplasty?
No, but when
No,
the-
it's good,
Okay.
because we only have a few minutes. We're over.
Yes, please.
If it didn't respond to that, I was really considering getting some nostalgia to see if
That's a good idea.
Or eosinophilia.
If it were not responding, I definitely would have done it. And in retrospect, I probably should have done it before I started lasering, but that was on me.